So here is a graph showing a meta-analysis of the association between 25-hydroxyvitamin D in the serum or plasma of humans and their risk of cardiovascular disease over time. 25-hydroxyvitamin D is a metabolite of vitamin D that is produced in the liver, but when we measure it in the blood, that's our best look into someone's vitamin D status. So I'll just refer to this as vitamin D status for the sake of simplicity. So when you're looking at this graph, you can see that as we go up the vertical axis, the risk of heart disease is increasing. And if we go across the horizontal axis, the concentrations of 25-OHD or vitamin D status is increasing. And if you look at these circles, each individual circle represents an individual risk estimate from a particular study. And because this is a meta-analysis, it means that it's pooling the results of many studies together. Now, if you look at this line here, what it's trying to do is generate an average to see the pooled trend from all these different studies. And when you see the shaded area, this represents the confidence interval. And that means that the narrower the shaded area is around that line, the greater our confidence is that that's where the actual risk is. But the wider that gray area is, the less confident we are about that data. And so you can see a couple things from this graph. One is that as we get higher and higher in vitamin D status, there are fewer and fewer of these circles, and the circles that are there are very small. That means that there's not much data in that range. The data that we have are from some pretty small studies with pretty few people actually having vitamin D status that high. Consequently, this shaded area is very large. When we look at concentrations between 8 and 28 nanograms per milliliter, we have a real lot of data, so the shaded area is very tight around the line. And what we can see is that between 8 and 24 nanograms per milliliter, we have a clearly decreasing risk of cardiovascular disease with increasing vitamin D status. But as we get higher and higher away from 24 nanograms per milliliter, it kind of looks like that risk stops decreasing. But what we really see is that's where the gray area starts really increasing, which means there's so little data up in that range that we really have no idea what's going on. And the reason this is a little concerning is because many advocates of vitamin D supplementation are saying we should all be at least this high or over here somewhere. And that's the place where we don't really have any data about heart disease, so we don't really know what's going on. After this meta-analysis was published, a new study came out in cardiac surgical patients. So these are patients with a very high risk of heart disease, and consequently, there was a very high proportion of them who had major cardiac events in the subsequent year after they measured vitamin D status. So they were able to get a real lot of data in a very short amount of time. And what they found was that between 20 and 40 nanograms per milliliter, there was a very large drop in the risk of major cardiac events compared to low vitamin D status. However, if you had vitamin D status over 40 nanograms per milliliter, then you were just as bad off as if you had very low vitamin D status under 12 nanograms per milliliter. So this indicates that there's a sweet spot here, and either higher or lower vitamin D status is harmful. Again, this is concerning because many people are trying to get their vitamin D status over here. Now, I should say that these are observational studies. They don't have the ability to show cause and effect. And so naturally, they don't show that having high or low vitamin D status is actually causing heart disease. However, I'd like to use this data to frame further evidence for a causal hypothesis that I'd be exploring today with you. Now, at first glance, and from what I've presented so far, this isn't necessarily all that paradoxical. Yes, it's a little bit odd that high vitamin D and low vitamin D can be harmful, but really it's not that much different from ideas we have like moderation and everything in moderation, too much or too little of a good thing can be bad. Too much water, too little water can be bad. This idea of a U-shaped risk curve isn't that paradoxical. However, it's a little paradoxical that the harmfulness or apparent possible harmfulness of having high and low vitamin D status is the exact same thing. And it gets even more paradoxical when we look at the mechanisms by which we can postulate that vitamin D status is having these effects, because it seems that the mechanism whereby high vitamin D status might contribute to heart disease and low vitamin D status might contribute to heart disease may be the same mechanism. And so that's where it really starts to get paradoxical. Now, before we get into that, let's look at some parallel data from kidney stones. We know from animal studies that if you give toxic quantities of vitamin D to an animal, you get widespread pathological calcification of soft tissues. That means calcium's going into the heart and the kidneys where it doesn't belong, and it's not and possibly at the expense of going to the bones and teeth where it does belong. And when it goes to the kidneys, what we see is kidney stones. And this is data from Israeli lifeguards who had twice as high vitamin D status as non-lifeguards in Israel, and they had about 20-fold higher incidence of kidney stones. And you can see that in southern Israel, the proportional increase in risk was not as high. It was 12-fold compared to 19-fold. But that's because the general population in southern Israel has twice the incidence of kidney stones as in northern Israel. And that's consistent with lots of observational studies showing that as you get closer to the equator, you get higher risks of kidney stones, and that could be related to increasing vitamin D status. Now, this 53 nanograms per milliliter isn't that much different from the higher than 40 nanograms per milliliter that we saw potentially contributing to heart disease in cardiac surgery patients. These authors noted that these Israeli lifeguards also had signs of dehydration and of skin damage, and they said that probably all of these contributed to the increased susceptibility to kidney stones. Again, that's probably not that different from the cardiac surgical patients who are not the general population. They are people who have specifically greater risk of heart disease because of other interacting factors. So we might propose from this that perhaps high vitamin D status is contributing to kidney stones and to heart disease when there are other interacting negative factors predisposing to those conditions, maybe not harmful in every specific person,